Healthcare is incredibly complex. We want to make sure that the healthcare experience for our patients is safe, seamless, and personal. Medications are used throughout the organization in physicians' offices. They're prescribed in the hospital. They're also prescribed in nursing homes and in home care. Medications are a very important part of treatment throughout the healthcare journey.
As a health system, we look at medications not just as prescription medications, but over-the-counter medications. All medications are important, and it's important for us to understand what medications our patients are on. So from a prescription medication perspective, what we do is we look at evidence-based data to identify what medications would be right for the patient depending on their disease state. And based off of that data, we make recommendations and we try different things. Sometimes they work, sometimes they don't. But the key is constant communication between the patient and the physician and appropriate follow-up. You can be an inpatient, you can be seeing somebody on the outpatient side. And so the importance is, how is that connected? We're connected through electronic medical record. So if somebody's on a certain medication, we identify that on the inpatient side. If they go to see one of our ambulatory providers, which is on the outpatient side, they will have all that information for them in an effort to be safe, seamless, and personal, to transform the healthcare experience, not just for our patients, but for our providers. What we try to do is we try to use data to let the physicians know at point of service if there's a medication interaction, or if there's a side effect, or if there's an allergy. Another piece of this in our effort to make it seamless for our patients is we have a Meds to Bed program here at Edward Hospital. What we try to do is, once we identify what medications you're to be discharged on, we try to bring those medications to the bedside with education. Number one, you know what medications you're taking and why you're taking it. You also have enough of a supply for when you see your doctor on the outpatient side.
Medications are wonderful. They have many positive benefits, but they also have side effects. And sometimes the side effects can be difficult for patients. So we want to make sure that patients understand what the potential side effects are so that they can monitor and watch for them. It's also important that patients only take medications as prescribed by a physician, and that they don't share their medications with other friends or family members.